is Patrick Rickmes himself, who is the CEO of the foundation. Good morning.
Good morning.
How are you doing?
I'm doing great, and you?
I'm doing well. It's good to have you here in the studio. And also joining us from the Kolebu Teaching Hospital, she's the pediatrician, Dr. Hilda Boy. Good morning.
Hello, good morning.
How are you doing?
Good, and you?
I'm fine, thank you. It's great to see you. So let's get into it. Hydrocephalus. What kind of condition is that?
Okay, so when we say hydrocephalus, it's a combination of like two words, the hydro portion and the cephalus portion. And the hydro means water and the cephalus like the brain. So there's a buildup of water in quotes in the brain. And the water that we are talking about in this case is actually cerebrospinal fluid, or what we say CSF. And that's the fluid that like it's around the brain, helping to protect the brain, and also goes through the spinal cord area. Okay, so there's a buildup of this fluid in the brain, where otherwise it would have been reabsorbed into circulation. You have it building up, causing the hydrocephalus. So when we are talking about CSF production, it's produced in the brain by the, we call it choroid plexus, but they are in the brain and they produce this fluid. And the way it works is that as it's being produced, it's supposed to be reabsorbed. So if you have any condition that causes the production to increase, or there's excessive production, there will be hydrocephalus. If you also have a situation whereby it's not being reabsorbed well or flowing well, then there will also be a buildup, which will lead to hydrocephalus.
So what is its function, that the fluids that build up? What function is it supposed to perform?
So it helps to protect the brain. It moves around the brain, the spinal cord, helping to protect it, to remove waste as well.
And what are the conditions that prevent it from performing that function? You mentioned that if it's not performing that function, then it builds up and it causes this condition. So what are the factors that lead to it not working as it should?
Okay, there are some children who are born with malformations in the brain. So because of the malformations, either the production has a problem or the flow has a problem. So there may be some blockages in the system which are not supposed to be and causing a blockage. So any of these can cause the child to have hydrocephalus. In older people, brain tumors, or when there's trauma, hydrocephalus can also occur. Another thing though is that if a child, for instance, has infections, meningitis or ventriculitis, or anything that causes an infection in the brain can cause the child to develop hydrocephalus as a result of blockage of the flow of the CSF.
But which individuals, if I can put it that way, are more prone to getting hydrocephalus? Children or adults?
So let's say both of them can have it, but the congenital ones are going to be seen in children.
When you say congenital ones,
the ones that they are born with are going to be seen in children.
And then adults, maybe when you suffer some brain trauma or some
or
accident
infection, or tumor, that's cancer, then you can have the hydrocephalus, or a bleed in the brain. All those things can lead to hydrocephalus.
So with the adults, of course, I mean, apart from maybe the tumor that you mentioned, what other external factors can influence, an adult's getting that condition? Is it maybe an accident? You suffer from a concussion?
Yes.
It gets you. Like, what are those external factors?
So for instance, you've had trauma, or from the road traffic accident, for instance, brain trauma, a heavy fall, you hit your head, there's bleeding in the brain. The complication could be hydrocephalus.
So in children who are born with it, how widespread is the condition? Is it very common?
Okay. I don't know if you want to come in here.
Yeah.
We've left you out a bit.
No, don't worry. I'll come to you.
You're doing great, so.
Yeah.
You're doing great.
I mean,
Okay,
of course, because you're a doctor, I wanted you to deal with the, the
it's
medical
fine.
aspect, and
It's
then
fine.
I'll come to you.
Yes.
So, yes, I want you to answer that question.
Okay, so unfortunately, I do not have the data from my department off the top of my head or from Ghana off the top of my head, but it is not one that is so common.
Okay.
Although it's not so common, we do see quite a number of children who have the condition in our hospitals, especially being tertiary centers or referral centers where people from all over the country will refer children with those conditions to us.
So, Patrick, you do some work in this area.
Yeah.
You're actually focused on that. And I mean, do you have any idea as to how often we see this or how widespread it is?
Well, how often you see it, as she said, is not that common, or you are not seeing it. They are in the system. But the issue is because of the stigma associated with the condition, parents or families who have children with the condition do not let them come out for people to know them. I think through our research, there's one article published. I think that was somewhere around 2018. Yeah. And the article, out of 6,550 CT scan examination, I think 251 was hydrocephalus condition recorded. So I think it's those, that research was done at Kolebu. I think one lecturer from UHAS and another team conducted that research. And they took the CT scan report to conduct that research. So the question I asked myself, what are those who were not able to take into Kolebu for treatments, those in Confanoche, those maybe Tamale Teaching Hospital and others, they were not captured into this research, which tells us one way or the other they are common, but because of the perception and because of the treatment factor, they are not being sent to hospital. So getting record about these conditions sometimes become a little bit challenging. Yeah.
But how dangerous is it if a child is born with this condition? I mean, is it likely a death sentence? Is it something that can be dealt with, that can be cured? I mean, will the child's life be the same even if there's a cure? What are the dangers of having this condition, especially in children?
Well, it's kind of fatal in children, but it can be managed and be treated by technology and advance in knowledge. I think we have other treatment procedures for children with the hydrocephalus, especially when it comes to the congenital one. Yeah. So, and even the acquired one, when it happens to be a brain tumor, I think we can. The doctors can help with the brain tumor to remove so that the CSF can flow normally as supposed to be. But it's not like it's a death sentence when your child have the condition. It's because the country we find ourselves, we are still at the tertiary prevention of certain diseases. That we look at the disability limitation and rehabilitation. That's why the conditions seem to be a little more fatal, and because the conditions seem to be very dangerous when you have a child with a condition. But I think in the outside there, where better procedures have been put in place, those children tend to live a normal life and they can live the age that God has given to them.
I'll come to you on the social impact of all of this, because your foundation is doing some work in that area. But back to you, Doc, and managing this condition, and how is that done? I mean, when there's a child born and the child is suffering from this condition, how is it managed, or how is it dealt with? Is there a cure, or it's just managed?
Okay, so the children who are born with hydrocephalus may have hydrocephalus and may have other conditions associated with the hydrocephalus. So there may be some who have just the hydrocephalus and others who have hydrocephalus, for instance, with probably swelling at the back. We call that myelomeningocele. There may be some who have the hydrocephalus. They may have a congenital heart disease or a hole in heart or a heart malformation, in addition to having the hydrocephalus. And having hydrocephalus, once there's good antenatal care, it can be picked up before the baby is even born. Because when the scans are done during pregnancy, We are able to tell what the sizes of the head is, whether there's excess fluid in it. So we are able to pick it up antenatally or even before the child is born. Now, if it is picked up before the child is born and the mother is, for instance, at a place where there are no pediatricians, for instance, or there are no people with the skill to deliver the baby, for instance, or to take care of the baby once the baby is born, then the recommendation is that the mother is referred to a hospital which has the facilities and the skilled personnel to care for the delivery of the mother or the delivery of the baby, and also care for the baby once the baby is born, because this baby may not be able to be delivered vaginally or have the SVD. I hope I'm not confusing anybody here.
Well, I think,
yes, so
I think it's clear now.
The mother may have to have a cesarean section as a result of that. Also, depending on what it is and the details antenatally, there's also room for terminating the pregnancy even ahead of the time for delivery. These are all things that can be discussed, and it's on an individual situation level. Once the baby is born, we'll do further tests. So we'll do the examinations, we'll do tests, we'll do x-rays, so x-ray of the bones, just to make sure that there are no other bone problems that the baby has. We'll scan the brain to see how much fluid is in there. We'll check how much brain matter is in there, because there are some of them who have very little brain tissue in them. So for those ones, it may be very difficult to pursue because the outlook or the chances of survival and all go down a bit. So depending on whatever situation, we proceed. But managing these people, like children with such conditions, is also what we'll call multidisciplinary approach. So it's not just the pediatrician or the doctor who is taking care of the baby. We'll need the help of the neurosurgeons. And the neurosurgeons are the ones who come in and perform surgery if it's indicated. So they will come in. Once the scans are also done, they will help to decide whether the baby requires the surgery or not. So for the surgery, we have what we call a VP shunt. So a shunt is put in so a tube is put in the brain.
Okay.
And then it's also directed into the tummy or the abdomen to help to drain the excess fluid that is in the brain so that it doesn't cause a buildup. Because when the buildup continues, the head becomes larger and larger and larger and larger, and becomes very difficult for the parents to care for the child at home or even to handle. So the VP shunt can come in. If there are other problems, let's say a heart condition, the cardiologist or the team of doctors who deal with heart condition also come in. For counseling, we the doctors will counsel the parents, all right, but if there's somebody who is into genetic counseling, that person can also come in. A clinical psychologist may be needed because this is a traumatizing experience for the parents. Having a child with a deformity, they don't know what's happening, what caused it, how to go about it, so it becomes very difficult on the family. So the clinical psychologists come in. As we manage the patients, if there's any other person who also needs to come in to make an input, we call the people in to come and help us manage their child. If they have the myelomeningocele, so what I talked about again at the back, the swelling at the back, the neurosurgeons again will help with the management of that. So we try to provide comprehensive care for the child, but it also depends on the extent of the problem. So if there's just a lot of fluid and very little brain, then it becomes difficult. But if the brain tissue is a lot and the fluid is not so much, then the intervention, once made early, chances of survival increase, and also the chances of the child doing very well in terms of not losing their vision, for instance, the intelligence improving, and all the movement or mobility, all those things.
It comes with brain damage.
Yes, it can cause brain damage because once there's a buildup of pressure in the brain function becomes impaired. They may have headaches, they may have convulsions, they may find it difficult walking or moving. It makes it difficult. They may even lose their vision.
So it's not like it's not like it's a death sentence. It's something that, if detected early, can be dealt with, and the child can live a normal life.
Yes, but even with that, it depends on the extent of what the problem is.
Okay.
There are some who may not survive, and there are some because of maybe the mildness of what the problem is. Once early intervention is initiated, the child does very well and will live a normal life. There are 60-year-olds, 70-year-olds who have had the hydrocephalus and are doing well. They have jobs, they are married, they've had children, they are doing everything.
And it doesn't
like
come back once it's been
no,
dealt
it doesn't
with.
come back. The only thing is that you need continuous follow-up.
Okay.
So for some of them, when you put the shunt in, you may need to actually review or change the shunt. Maybe if it gets blocked, you put in another one. So they need the follow-up from time to time. But there are some who may not even need the shunt to be changed frequently. But ultimately, once whatever we need to do is done, that's if the shunt is put in, whatever other problems are there are solved, regular follow-up is still needed, but you can live a normal life.
So, Patrick, tell me, in your experience, what is the social stigma that comes with this condition, especially on the part of the children who are born with it and even their parents? How bad is it?
Yeah, the social stigma is very bad because society perceives those children as a rival God or under the influence of God, some ancestors. So when it happens like that, people do not want to associate themselves with children with their condition. People, as the child, the head grew big, they try to also, apportion some names to them, like in Chi, we say Itikelenkele and those styles. So sometimes when you go to the field, they have interaction with them. That's what they have been saying. And with that, it has make them not mingle with the society, let them out of the society. Some of the children are even left on the streets to fend for themselves. Others find themselves in the the orphanage homes and other places, which is very bad. Yeah, so therefore.
And when they get to places like that, it becomes even more difficult for them to get any kind of proper medical attention.
Exactly.
So is that where the Rickmes Foundation comes in?
Yes.
How do you help with all of this?
Yeah. So what we do is one, we up to create more awareness about the condition. We believe that before you can change something, you need to change the perception of people towards it. So even if you give treatment to that person, and the person have the treatment, but still the perception of Ghanaians still holds. Definitely the stigma will still be there. They will be seen as vulnerable in the society. So the best thing to do is one to tackle the awareness about the condition. Let people understand that it's not as we think the condition is, but it's something that happens within the brain, that's the ventricular system, that causes the condition. Therefore, it's time for us to bring them together in the society we find ourselves, in order for us to have, a society that is disability friendly. You get it? So when we do more of the advocacy too, we come to the supporting aspect where we make the treatment for hydrocephalus is very expensive. If to treat a child with hydrocephalus, we are looking at almost above 10,000 Ghana cedis. And most parents with the condition are from the lower or the middle social economic status or class. So they are not able to afford this treatment. Yeah. Therefore, they tend to be like, okay, the child should leave. If it's the will of God for the child to survive, fine. If it doesn't, then the child pass on. And then the condition, as the fluid continue to be in the head of the child, cause a lot of damage to the child. That's what doctor said. Yeah. From the vision, hearing, the physical appearance of the child and everything. So we have to minimize the disability that will come upon the child when the treatment is not given, to save the life of the child. So we come in to support the surgery by raising funds in order to support the surgical operation of the child. And now we are looking at the primary prevention of the condition. That's at the onset of the condition, we are there to support, so that it will not, lead to either secondary, prevention or tertiary prevention of the condition. So that's what Rickmes Foundation stands to do.
And so far, what are some of the the major cases, for example, that you've worked on and the successes of that?
Yeah. So far, we have 4 of the cases that we are working on right now. We are done with all the diagnosis. We left for the surgery to be conducted. But as I said, it's a very expensive surgery, and you know the neurosurgeons are very scarce in the system.
Yeah.
So getting them on board, you know, they can't come and do it for free. We have to also purchase the VP shunt, and then other equipment that will be needed for the surgery, and all boils down to money. So after the diagnosis has been done, we are working on to get some money to proceed with the next step, that is the surgery. That's what now we are doing right now.
So, Doc, in Ghana, for example, and with the nature of our healthcare delivery system, do we always have the comprehensive nature of it, you know, to deal with a condition like hydrocephalus? Because you mentioned we need a pediatrician, we need a neurosurgeon, you need other people, all of these elements involved. So, is it difficult to get a comprehensive healthcare for someone who is suffering from hydrocephalus in Ghana?
Let me answer that by saying that, well, it's probably a bit difficult, but if you find yourself in the right place at the right time, then whatever you need can be provided once you can afford it. Because I think Komfo-Anokye Teaching Hospital being a tertiary center, Korle-Bu Teaching Hospital, we have the neurosurgeons, we have the so we have the team that is able to deal with it. One of the most important things for us is that the people or the babies who are affected come in on time and do not wait for too long at home before coming. Because if they come in at the time when the head is already very large, then there's almost nothing that you can do to salvage the situation, because by that time a lot of harm has been done already.
So like that, it means that the child is more or less going to die?
Eventually, even if not directly from the hydrocephalus itself, from complications of the hydrocephalus. And sometimes they may not be feeding well, so malnutrition sets in, then they have infections if parents are force feeding, and also there are a lot of dynamics that come into play with having children who have disability. But most importantly, they should come in early as we try as a society, as a country, to provide the services that they need. They should try and come in early. And also we ourselves as people in the country, people of Ghana, people everywhere, we should know that definitely all the 5 fingers are not equal, and so we may have children who are born with one deformity or the other, or even adults who have deformities. And different does not mean that we should shun the person, or that the person does not have anything to contribute to the world. So all these people, once they are seen early, once the care is initiated early, it looks good for many of them. So
how do would-be mothers ensure that they don't have children who have this hydrocephalus? I mean, what are the things that you should do to prevent it?
For most of the things that bring it on, it's difficult to say you can prevent it directly.
Okay.
However, because we know that it's CNS formation, like the central nervous system or brain formation issue, the folic acid before pregnancy, and especially within the first few weeks of pregnancy, is very helpful, because it will help to prevent the neural tube defects, like the one I mentioned, the swelling at the back. It helps to prevent it, and it's also somehow connected with the hydrocephalus. Another thing also is that when you find that your child is unwell, has a fever, is unwell, go to hospital early. If this infection happens to be meningitis or ventriculitis or something, it can predispose or cause the child to develop the complication of hydrocephalus. So once you have a child who has a fever or is unwell, try and come to hospital early so that treatment can be initiated. Also, if you notice any abnormality with your child, maybe the head looks big or the child doesn't look quite normal, just come to hospital early so that whatever it is can be picked up early and the intervention is initiated. Yes,
is key.
Early detection is key.
And finally, Patrick, with you, of course, I know your foundation is doing some good work, so perhaps you'd want to say something to those watching, you know, to come on board, to, you know, to aid, so that we can create more awareness and, you know, do some good work for especially children who have hydrocephalus.
Yeah, what I would say is this condition is something that should be a nationwide attention, attention should be given to. It shouldn't be an individual battle. So I think that it's time for the nation to come on board. The Ministry of Health, the Ministry of Gender, Ministry of Local Government, all ministries that work for persons with disability, because this condition will lead to disability. Ministries in charge of health, they have to also to come about to help so that we save the life of persons with disabilities, hydrocephalus. And then again, also count on the philanthropists within the country that when they are pushing some of their resources into the corporate social responsibilities, I think it's time also to shift into this fraternity of health condition, because these people are going to a whole lot of difficulties, a whole lot of struggle, and they need help, they need support.
Okay.
That's what we're taking upon ourselves to help. So we plead with them that they should come on board to give us the necessary backing and support that we need in order to reach out to these people. Because when the government institute any policy, especially when it comes to health prevention policies, there are some institutions or some organizations that have to pick it up to make sure that that policy is being implemented or reach the appropriate quarters or appropriate individuals.
All right.
So that's why Rickmes Foundation is there, to make sure that persons with hydrocephalus, policies that's drawn for them.
Yeah, would also include them.
Include them.
Okay.
Yeah.
All right. Thank you very much. This is all time will permit us to do this morning, but I'm grateful that both of you have joined us in the studio today for us to have this discussion. Patrick, thank you very much from the Rickmes Foundation. And Dr. Boy, thank you very much for joining us in the studio. And this will wrap it up for Health Check this morning, and also wrap it up for GH Today this morning here on GH1 Television. I've not been here alone. I've been doing this with my co-host Sewami here. My name is Lantam Papanko. We'll be here again tomorrow to bring you the Friday edition of GH Today on GH1 Television. Enjoy the rest of your day.
Show your love, oh, show your love, eh? Show your love, oh, show your love, ah. Show your love, oh, show your love, ah.
GH1 TV, your best experience.